o'clock this morning? Okay. Who got off work early? All because you guys wanted to come to this workshop, right? Spend an extra hour at your chiropractor's office, right? To learn everything you never wanted to know about health and healing. Nailed it, Cody?
Yeah.
All kidding aside, I want to recognize everybody for being here because it tells me a few things about this group of people. One, it tells me that your health is a priority. It's important to you, which is important to me. Okay? Two, it tells me you're action takers. Now, we've cared for thousands of patients over the years, and I can tell you action takers always get the best results. Okay? Now, if you're a guest, I want to welcome you guys as well. It tells me a few things about you. You're open to learning new things, right? To learning a new way. Or you're just simply here to support somebody. We all need a little extra support. Okay, so I'm going to welcome you guests as well. I love doing this workshop. This is some of the most important time we will spend with one another. And it's because this is where I get to share some of my most important information. Okay, so I promise this won't be a waste of our time so long as you guys can commit to three things, okay? Number one, can we have fun? Can we engage? Can we create like a discussion? We're all here, we're stuck. Roxanne locked the door, so let's have a little bit of fun. Two, I just want you to listen, okay? I want you to truly listen to the information that we go over. And three, the most important, I want you to think, okay? I would never ask you to think like me, but I will ask you to think. Can we commit to that? Cool. This is going to be good. Now, we have a whole slew of professionals in here, okay? And I don't know about in your profession, but in my profession, I got to attend a lot of conferences, a lot of seminars, right? There's a lot of continuing education. And the trend that I see is I always get the most out of a message if I know a little bit more about the messenger, right? Why do I make you guys come 6 o'clock Wednesday night? It's bath night in my house. That's like the funnest time for me, right? Why do I make you come 6 o'clock Wednesday night to learn how to get better results, right? What drives me? Permission to share my story? Okay. I always knew that I wanted to do something in the healthcare field. Okay? I wanted to help people. I wanted to help them achieve their health goals, overcome their health struggles. That's just where my passion lays. It feels good to help somebody else, right? And as I started looking at different options in the healthcare field, I realized that there was only one option for me. Chiropractic was the best vessel for me to help people the way that I wanted to. Okay? Chiropractic helped me in a healthcare crisis. Okay? I had a sports injury where I was sidelined for 3 weeks. Everything else I tried failed me. And it was a chiropractor that got me back on the playing field. And when I started looking into what chiropractors teach, it was exactly what my mom taught me from a young age. We lived what would be termed now the wellness lifestyle. Okay, so in my household, me and all my sisters, we were born at home. We never went to the doctor. We never took any medication. Everything we ate was naturally organic because it literally grew in the yard or it was something that we harvested in the wild. We were always engaging with other people. We didn't have the technology that we have today. We were always enrolled in a sport, being active. Right? And we know that's the ticket to health, right? Our health outcomes are determined by how we eat, how we move, how we think, how we socialize, right? And what you guys learned tonight, also the function of your nervous system. So for me, chiropractic was easy choice. There was no other route to go. But that's not why we focus on education. That's not why I'm speaking to you guys tonight. You see, the reason I speak to you guys and educate you guys and go around in the community to speak is plain and simple, it's my duty. It's my responsibility. Okay? I have a moral obligation to help educate this community. I learned a very tough but valuable lesson my last year of chiropractic school. What I learned is if I don't speak up, okay, if I don't tell the truth about health, healing, where it comes from, how to achieve it, and the role that the spine and nervous system plays in that overall picture, plain and simple, people are going to suffer. People are going to get sick. And unfortunately for some people, they're going to die prematurely. Okay? And I didn't learn that lesson from a class. It wasn't a staff doc. It wasn't a colleague. It wasn't even a patient. He was my uncle. Right? My Uncle Bullet. So you can imagine how fun he was with a name like Bullet. Right? 70 years old. Guy loved to have fun. Okay? Loved to work. He worked hard. He had 2 jobs, 2 full-time jobs. He was a farmer, and he also worked in the quarry. So he worked himself to the bone. I don't know anybody that worked as hard as he did, and I think that's why he was so playful. Okay? At 70 years old, he had like the childlike spirit of a 7-year-old. Okay? And what I mean by that is if like it involved fireworks or firearms or you could drive it, he was like first one in, pedal to the metal, first one striking the match or pulling the trigger. Okay? Guy loved to gamble. Okay? Not because he had a gambling problem. It didn't matter if you were playing for popcorn or poker chips or if you were playing slots or Texas Hold'em. He just loved to have fun. Okay? Never partied though. I never saw my uncle with a drink in his hand. So when I say he liked to have fun, he liked to play like a little kid, didn't party. I also never saw my uncle drink a glass of water. Okay? When I look back at my uncle's case, my uncle had 2 things in his hand at almost all times. Okay? He had a can of Pepsi and a Pall Mall. Okay? What he called his cigarettes. Okay? Skinny guy. He worked really hard. But when I assessed his diet, if it wasn't pork, chicken, beef, or a potato, he wouldn't eat it. Even as a farmer, if it was any type of vegetable, he pretty much thought it was poison. Okay? So there are some things in the guy's lifestyle that could have been cleaned up. And I'm going to be honest, at 7 years old, how stubborn my uncle was, there's nothing I could have ever said to my uncle to get him to eat kale. Okay? Or stop drinking his Pepsi, or to stop smoking for that matter. When I look back at my uncle's health journey, there was something that I could have done. Okay? And it all started after brunch one morning. I'm sitting there shooting the breeze with my uncle, and I notice he leans back and he throws his arm up over his head and he gives a groan, and I thought he just like ate too much. Like he was one of those like, you just gotta make a little bit of room. And I looked at his face and I realized that's not what he was doing. He was actually grimacing. He was in some pain or discomfort. And I said, Bullet, what's going on? Is your arm hurting you? And the most overused statement by my uncle was, "Ah, hell. Ah, hell, it's my shoulder." And I was like, okay, you're 70 years old, you got 2 full-time jobs, you probably just tweaked it. You sprained, strained it, whatever. A couple weeks, it'll heal up, you'll be all right. And a couple weeks go by, and I notice it doesn't go away. And a couple more weeks go by, and I realize it has gotten worse. The grimace on his face got worse. I can tell he's in some serious distress. And I ask him, Bullet, is that shoulder still bugging you? And he goes, hell. It's not my shoulder, it's my entire arm. And he explains to me that it's not just his shoulder that hurts. It's his upper arm, it's his forearm, it's his hand. He's got numbness, he's got tingling, he's got burning. His arm is really, really bothering him. And I say, when you lift your arm up over your head like this, it makes the pain go away? And he goes, yeah. And right then, I knew exactly what was going on with my uncle. In school, we have to take physical diagnosis, orthopedics, and that's a telltale sign that there's nerve irritation in the lower neck. Most likely what was going on with my uncle is he had a disc herniation, okay, which means one of the spacers in his spine had actually herniated, and he's got pressure and irritation pushing on the nerves coming out of the lower neck. It just so happens to be the nerves that feed and supply the shoulder, the arm, the hand. Okay? And when he has his arms down, he's tractioning that nerve out, pulling it into that disc herniation, and he has symptoms. But if he just tips his head a little bit to the side, and he lifts his arm up over his head, it actually creates a little bit of slack within those nerves, and he can relieve that irritation. The pain goes away. And I tell him what's going on, and I kind of just leave it at that. Because at this time in our life, I still got a whole another year of school left. Okay? My clinical skills, I'm just trying to learn how to not hurt somebody when I get out of school, let alone help somebody at this point, right? And we're grinding, we're trying to figure out what we're going to do when we're getting out of school. We got to study for boards, we got to pass these strict tests, and we're also planning a wedding. Okay, so I got a lot on my plate. And that summer, we get married, me and the woman of my dreams, Dr. Heather, right? We get married that summer, and the day of my wedding, Bullet calls me, And he says, he just leaves a message. And he goes, you got to call me. I got something to tell you. So I asked my dad, I said, what do you think that's all about? And he goes, what do you mean that's all about? It's Bullet. He wants to give you the talk. I'm like, the talk? Yeah, the talk that everybody needs to have before they get married. And I get to thinking, I'm like, my uncle's 70 years old. He's been married for over 50 years, married his high school sweetheart. Man, he probably has some really good advice. I want to make sure that we have this conversation in person. So, get through the wedding, we survive, and then get through the honeymoon, and we're back at school grinding away, and I haven't seen my uncle in a while. And my dad calls me one morning, and all he says on the other end is, Bullet died last night. And my heart sank, and I lost it. And I said, Dad, I never called him back. And he says, it's okay, son. But the thing is, it's not okay. In my uncle's situation, he woke up in the middle of the night and he couldn't breathe. He couldn't get any oxygen into his lungs. And he eventually passed away. He dies from some type of cardiorespiratory event. Okay? Whether he had fluid buildup in his lungs or he had a heart attack, we don't know. When I look at my uncle's situation, the exact same nerves that exit the neck, the lower cervical spine, the feed and supply the shoulder, the arm, the forearm, the hand. There's those exact same nerves. There's branches that are going to feed and supply the lungs, the heart, the diaphragm. Okay? So there's multiple things that my uncle could have done in his health journey to make sure that he was here today. Right? But I know from the bottom of my heart that that issue that was going on in his spine is part of the reason that he is not here today. I didn't get to hear my uncle's message because I didn't give him mine. The one about health, healing, where it comes from, how to achieve it, and the role that his spine is actually playing in that overall process. So now it's a duty, it's an obligation, okay, to make sure that no matter what, we stand up and we speak the truth into our patients. So that's why education is such a big part of our clinic. So that's why I'm here tonight, instead of at bath time, but you guys are here for a different reason, right? To get better results. Now, plain and simple, over the years, we've come up with a very simple equation to get better health outcomes. If you want a different outcome, all you gotta do is behave a little different. You gotta act different, right? Now, how easy is that? Simple equation, but really, how easy is that? Like impossible? If we just attack a behavior, man, that sucks. It's unsustainable. So here's what behavioral psychology teaches us. Yeah, it's going to be those behaviors that drive our outcomes. However, what drives our behaviors? It's our belief systems, right? So we give multiple workshops over the course of the year to help people with behaviors, what you got to do to be healthy. But if we don't set the foundation, if we don't address our belief systems around health, you're never going to be able to do all those behaviors. Okay, they're going to be unsustainable. Okay, so we're setting the foundation. We're going to talk about beliefs. What do we believe when it comes to health? Is healthy normal? A little play on words here, right? Is healthy normal? Everybody's afraid. You promised me, you committed that you would engage. All right? I'm going to tell you, healthy is normal, right? I've been studying health and healing for the past 15 years. It's been an obsession. I can tell you, you are genetically designed to be healthy, right? We are supposed to be healthy. That's normal. But is it the norm? No. Not even close, right? Not for 80% of the population. Is the United States healthy?
No.
Not even close, right? Now, when we look at all these health conditions that are plaguing our society, plaguing the United States, what's our typical solution?
Pills.
You got it, right? Drugs. Who do you think takes the most prescription drugs out of any country in the world? Oh yeah, we win that gold medal. So no surprise, we have a health crisis, okay? We have a lot of sick people in this country. The #1 killer in this country, heart disease. Literally takes nearly 1 million people from us every single year. And we have some of the best researchers, best doctors in the world saying, we know exactly what causes heart disease. It's our lifestyle, right? It's the way that we live. We're doing it to ourselves. However, traditionally, what's our intervention? You come in with high blood pressure, you come in with elevated cholesterol.
Get drugs.
Drugs! And how long are you going to have to take that drug?
For the rest of your life.
For the rest of your life. So we got some of the smartest people in the healthcare industry saying it's the way we're living. But yet, we're giving somebody a drug for the rest of their life. That's just a permission slip, right? Don't change what you're doing. It's causing the problem. We'll just cover up the symptom, okay? When we look at this drug problem, it's an issue. Does anybody know what percentage of the population the United States accounts for out of the entire world?
Like a third.
Actually, 5% of the world's population. Guess what? We consume 75% of the world's pharmaceuticals. Okay? And multiple drugs get pulled off the market every single year. Has anybody ever heard of Vioxx? Non-steroidal anti-inflammatory drug. Okay? And it's a Cox-2 inhibitor. If you have pain and inflammation, you might have been given this drug. So for instance, if you had an arthritic condition, if you had a surgery, you might be given this drug. One of the main things this drug was given for was to teenage girls who had painful menstrual cycles. And when we look back at this drug, it got yanked off the market in 2004 because it was directly attributed to 60,000 deaths. It's a lot of people, right? Anybody know the population of Cheyenne?
6,000.
Right there, right? Entire city, gone. One drug. And when we look at the medical profession's stats, they admit we have a problem, okay? Straight out of the Journal of the American Medical Association, they say we lose nearly 120,000 people every single year from properly prescribed drugs, okay? It doesn't mean that you had a wicked cross reaction or that you misused or you abused that drug. You got the right drug for the right condition and you actually took it exactly how you were supposed to take it. We still lose 120,000 people every single year. Any numbers, people in here? Okay, so you're thinking, well, the United States, we're sitting at like 325 million people. 120,000, that's not that bad, right? Okay, that's a lot. That's a lot of people, right? So I like to put things into perspective. This is how I learn. Like, give me something I can associate this with. So anybody ever been on one of these jumbo jets? Yeah, they can carry hundreds of people, right? It's the equivalent of one of those jumbo jets falling out of the sky every single day. Everybody on board. Anybody ever been on a cruise? They're a ton of fun. They house thousands of people. It's the equivalent of one of these sinking in the middle of the ocean every single week. Okay? Now, there's thousands of planes that take off every single day, but if one of those was falling out of the sky every single day, would we hear about it?
Yeah.
Okay. Would we get on a plane? Okay. Would that industry probably be bankrupt? Be under massive investigation? Same thing with the cruise line industry. We would find a different way to travel. I promise you. Okay, but when it comes to this drug problem, the majority of people, they don't even look at that product insert that their drugs come with. They don't even know what the potential side effects of those drugs could be. So if we're ever going to troubleshoot this health issue, we got to tackle this drug issue. Okay? And I want to pause for a second. Don't think that I am completely crazy. Okay? Is there a time and a place for drugs? Absolutely. And when we use them appropriately, can they save a life? Absolutely. If one of my kids has appendicitis, I'm rushing them to the emergency room and I hope they give them an antibiotic. Okay? But that's not what we're using these drugs for anymore. Okay? That crisis, that trauma care, is only about 10 to 15% of the healthcare spending in the United States. Okay? So when we look at costs, who do you think spends the most on healthcare?
We do.
We win the gold medal again. So where do we rank? We take the most drugs, we spend more than anybody else. How do we stack up?
No.
You got it.
Oh my
right?
gosh.
And here's what I want people to realize is this is not just a health issue, this is an economic issue. This is costing us a ton of money as a country. When we look at the money that we spend on healthcare, we spend $3.2 trillion every single year on the sick care system that we have adopted. And that's expected to grow by about 6% every year. 6% on $3.2 trillion is a lot of money. Okay? So to break that down, it's about 10 grand for every man, woman, and child in this country. It is 18% of our gross domestic product, meaning 18 cents out of every dollar we spend in this country going towards the sick care system. And despite our soaring investment, guys, we rank really, really low. And it's not just bankrupting our country, it's bankrupting our households. The number one cause of bankruptcy in our country is health issues and medical bills. Okay? The World Health Organization, they did a study in the early 2000s, and they looked at the health of multiple countries. And then they segregated out 40 industrialized nations. Now, when they looked at everything and all of the markers, we ranked 38th out of those 40 industrialized nations when it came to health. The Institute of Medicine did a really good study just about 5 years ago. And they compared 17 industrialized nations, 17 richer nations. Now what they found, the United States is 17 out of 17 when it comes to health. The Commonwealth Fund did another study, looked at 11 industrialized nations. We were 11 out of 11. Okay, so every good research study that has been done looking at the health of different countries, we're at the very bottom. We take more drugs, we spend more than any other country, 3 times as much as any other country. And the CDC in 2009, they came out and said, for the first time in the history of man, children born after the year 2000, they're not expected to live as long as their parents, meaning life expectancy is going down. Okay? Quality of life expectancy is going way down. So all I suggest is our current model, our current system, it's letting us down. It's failing us. Okay? I could give you all the stats, all the research, but what do you guys think? Obesity, going up or going up?
Up.
Yeah, it's going up. Right? You know that 2/3 of the population are either overweight or obese. There are states in the South where literally 40% of the population is clinically obese. What do you think about heart disease? We went in the war on heart disease?
No.
No, heart disease is kicking our butt. We have more people with heart disease than we've ever had before. What about cancer? It's going up, right? And in fact, cancer is going to catch heart disease here soon as the #1 killer, is my prediction. What about asthma, allergies, things like ADD, ADHD? Do you remember like when we were in school, we had the one kid that had asthma or the one kid that had a peanut allergy? Now everybody has asthma, everybody has allergies. Autism, right? The current rate for autism, if you look at the male population, if you're a male born in today's age, you have a 1 in 36 chance of having autism. 1 in 8 couples struggle to conceive. Okay? So when we look at all these conditions, they're going through the roof. We're not winning this battle on chronic illness. So you know the old adage, right? If we keep doing what we've been doing, we're going to keep getting old. You got it, right? We're going to keep getting exactly what we've been getting. So my question for everybody in here is, what is your most important asset? What's important to you?
Family.
Family? Good.
Bath night.
Oh, bath night is very important. See? I'll challenge people, say, what's your most important asset? And some people have even told me money. I've had some people come in and they really like money. But I promise you, if you lose your health, you'll spend every dollar to try and get it back. Okay? I had one guy tell me, I challenged him, I said, well, isn't health your greatest asset? And he says, no, my greatest asset is actually, I guess, my spiritual health, my ability to serve my Creator. But here's what we've got to realize is, isn't this physical body the means through which our soul travels? Isn't that how we serve our Creator? So if we lose our health, how good are we at that? How good are we at that? Family. That was my struggle. I got a lovely wife. I got 2 beautiful kids. I would literally give my own life for those kids. But if I lose my health, how good of a dad am I? If I'm not here, is that more of a burden on them than anything?
It'd be a burden on me.
So, we gotta realize that health is our most important asset. For me to be that loving, caring, compassionate father and husband, I gotta have my health. And the second question we gotta ask ourselves, and don't answer this one out loud, are we as healthy as we want to be? Unfortunately, for 80% of the population, the answer to this question is no. So we gotta troubleshoot it. Why are we in this health crisis? So me and Dr. Heather, we've come up with 3 reasons we personally feel we're in this health crisis. Number 1, lack of personal responsibility. We seem to think it's somebody else's responsibility. Right? The government will bail us out of this situation. Maybe privatize insurance. They'll take care of me. If I lose my health, my insurance will take care of me, right? Okay. We got to step up. We got to take more responsibility. Our health is our responsibility. And nobody cares more about your health, your family's health than you. Number 2, we just have the wrong definition of health. We have the worst definition of health I think I have ever heard. And it usually goes somewhere along the lines of, well, I look good, I feel good, I don't have a symptom. Must be healthy, right? The third one, Cody, you're going to remind me if I forget. Okay? All right, don't let me forget. This entire workshop will be ruined if you let me forget. Okay? So here's the typical definition of health. I'll go around and I'll speak and I'll say, Cody, how do you know that you're healthy? And like I said, typically it's along the lines of, I look good, I feel good, I don't have a symptom or a disease or a condition, I'm not on any medication. I must be healthy by default, right? But let me ask you, number 1 killer in our country, heart disease. Number 2 killer in our country, cancer. Now by the time you feel heart disease, or the time you feel cancer, are you in big trouble or are you in huge trouble? Huge, right? Exactly. Statistically speaking, 50% of the time, your first sign or symptom that something's wrong with your heart is what?
Heart attack.
Heart attack. It could be death. Right? We can't wait around for symptoms. We can't base our health off of symptoms. Do you remember this guy? Patrick Swayze, Dirty Dancing, Roadhouse, Point Break, Ghost. 1990s, voted the sexiest man alive. We can all see why. He looked good, he felt good, right? That's Patrick Swayze a few months before he passed away. Do you guys remember what he died of?
Pancreatic cancer.
Pancreatic cancer, yep, you got it. By the time Patrick Swayze had any signs or symptoms that anything was going on, stage 4, metastasized through his entire body. There's little that anybody can do for him. Okay? Not meant to scare you, but if we talk to an oncologist and we say, cancer, how long does it take to develop? I'm going to tell you it's a process, right? Sometimes it could take the better part of a decade for us to just feel a palpable sized tumor, right? So very well, when he was voted sexiest man alive, on a cellular level, the process was probably already taking place. And we know there's things Patrick Swayze could have done in his lifestyle to clean it up and maybe prevent that. But unfortunately, by the time he had any indicators something was going on, it was too late. That's not meant to scare you. That's just meant to prove my point that the top 2 killers in our country are silent killers. They don't necessarily have symptoms. But when we do have a symptom, what are we ingrained to do?
Go to the doctor.
Cover it up, right? Put a Band-Aid over it. I'm here to tell you that the symptom, it's not the problem. And those symptoms can actually be really important. Right? If we just continue to chip away at the top 10% of this thing, right, the symptom, what happens below? Does the cause just get worse and bigger and more of a problem? Absolutely. Right? So we need to stop just covering up symptoms and chipping away at the top 10% of this iceberg. We need to figure out what's causing this puppy. And we need to listen to our bodies and acknowledge our bodies. Okay? So what is the definition of health? World Health Organization, I think they got the best one. They say it's a state of complete physical, mental, and social well-being. It's not merely the absence of disease or infirmity. So they're saying it's this all-encompassing thing. It's not just not having symptoms or a disease or a condition. And if we break this down even further, the most simple definition I can come up with, health is equal to function. Optimal cell function, optimal system function. So if we want to improve health, we got to improve function. You guys know what controls function in the body? There's a hierarchy of systems in the body. You guys know what it is?
Central nervous system.
You got it. Let's say current patient, don't let me down. The nervous system, right? We literally live our lives through our nervous system. It's our master system. What we see, what we hear, touch, smell, taste, how we react to our environment. We can't digest a meal, we can't have muscle control, we can't have proper immune system function without a properly functioning nervous system. This thing runs the show. This thing determines function in our body. So if there's one thing I want everybody to understand, is your nervous system is your master system. I don't care where you look, what text, what professor you ask, what healthcare provider you ask, all of them should have the exact same answer when it comes to this matter. The nervous system is the master system. It controls everything in your body. And number two, which is even more important in my opinion for you guys to understand, is that your body's smart. It makes me so mad. Somewhere along the way, somebody told us that our bodies are stupid. I don't know if it's a drug commercial or if it's a medical provider or what, but we seem to think we got to take some type of pill, potion, or lotion to make us healthy. Your body's smart. Everybody in here is a miracle. I wish Taylor was in here right now and prove it, right? But you know we all start out as two teeny, tiny little microscopic cells. Those two cells join together, they form 4, divide into 8, 16, 32, 64, 128, so on and so on and so on. And in 9 months, we literally have a living, breathing human being. 2 microscopic cells, 9 months, human being. Blow your mind? Blows my mind every single time I think about it. And when we look at that entire process, does that require a lot of intelligence? You think, for that to happen? Man, there's a tremendous amount of intelligence there. Your body is smart. And when we look at how these cells divide, the very first system to develop in utero, what do you think it is? It's your nervous system, right? Everything else depends on it. If we don't have that nervous system, we got nothing else. Now, once that baby actually develops in utero, we birth that baby, do we think that intelligence is poof, it's gone, thin air, it's no longer there? It's still there. Your body is still smart, and that intelligence, it courses along your nervous system, and it keeps us healthy, and it keeps us healing. So your body is a self-healing, self-regulating organism. If you break a bone, does it heal? Now, you might need a cast, you might need a plate, but in all reality, it's not the cast, it's not the plate or the screws or anything that healed the bone. You did it, right? You laid down new bone cells, you formed a callus, and the thing healed. If we get a cut, if we get a scrape, does nature have a great Band-Aid? Yeah, pretty cool. If we get a cold, a flu, can we overcome that illness on our own? Yeah. We'll start secreting antibodies, making antibodies, and we'll fight that thing. Pretty cool. Our body's a self-healing, self-regulating organism, and it is because of that nervous system. So here's an oversimplification of that nervous system. We got the brain up here that runs the show. An extension of the brain is the spinal cord. It runs right down the center of your vertebral column. And branching off of that spinal cord, you got these nerve roots that feed and supply literally every organ, tissue, and structure that you have in your body. So your brain, always talking your body. Your body, always picking up information on the environment, sending a signal back to the brain. This is how all communication in the body happens. This is how all health, how all healing, and how all functioning in the body occurs as well. When we look at that nervous system, it's important, right? But it's also very delicate. So we got a really brilliant design. I mean, we got something to protect that nervous system. What do you think it is? You got it. We got a suit of armor, right? God gave us a helmet to protect our brain, and He gave us a suit of armor to protect our spinal cord and those peripheral nerves. So what happens if we damage the spine?
You hurt.
You might hurt, and you feel that pain because of your nervous system, right? So we damage the spine, we interfere with the function of that nervous system, we interfere with our body's ability to heal and regulate on its own. The best example I can think of is, do you guys remember Superman? Do you remember what happened to him?
Fell off a horse.
Fell off a horse, yeah, he had an equine accident, and he fractured C1, C2. And because of that inflammation and displacement of those bones, he had so much pressure and irritation on his brainstem, left him aquatic, right? Couldn't move anything from the neck down. Musculoskeletal system didn't work, right? He couldn't breathe on his own, right? Poor guy had to be put on a ventilator. What about bowel, bladder, reproductive function? What do you think? Didn't work. They shut down, right? This poor guy had to have somebody push on his abdomen to remove the contents of his colon into a colostomy bag every single day. He struggled with multiple lung infections. His immune system didn't function properly, and he eventually died from cardiac arrest after 9 years like this. All the direct result of that nerve irritation. Okay? And that's what we deal with every single day, just not to this extent. Okay? Does this look like any of you guys?
No.
None of you, right? I know some of you.
I didn't sit up straight.
You guys share this one, right? Here you go. All right. Anybody ever been in a car accident? Anybody ever had a slip, a fall? What about a sports injury?
Yeah.
Right, a work injury? Anybody have a desk job?
Yeah.
Yeah. Anybody spend 8 hours on a computer? Anybody ever been through the birth process? Okay. We put our spines through a lot. Okay? Day in, day out. We have big traumas, we have little micro traumas. They can create a condition in the spine known as subluxation. Okay? So what I did is I created a little spine for you guys. Okay? So I ripped a chunk out of a big spine, which is no longer in here. I apologize. Ripped a chunk out of a spine. I got 3 segments, right? And I always show you a dry spine, and what that means is it doesn't have any soft tissue around it. So there's no muscles, there's no tendons, there's no ligaments around this spine. This isn't really how our spine exists. So I tried to figure out a way to recreate that soft tissue so you guys have a better model than me. Okay? You got some soft tissue around your spine. Now, whenever we have a subluxation, what happens is, plain and simple, we have a spinal segment that gets shifted or jarred out of its normal healthy position. So what I want you to do is just take that middle segment, that middle vertebrae, I just want you to jar it out of its normal position. Push it to the side, twist it, do whatever you need to do. Now what happens to the soft tissue around the spine?
Stretches.
It gets stretched, it gets strained. In other words, we have tissue damage. Now whenever we have tissue damage, guess what comes with that? Inflammation,
Pain.
possibly pain. Right? Now, if we have inflammation in that area as the result of that tissue irritation, what happens to these nerves?
Irritated.
They get irritated. Right? What if this nerve goes to your stomach? Might have a stomach issue, right? Might have a stomach malfunction or dysfunction, right? But I just told you the body was smart. We gotta have a defense mechanism against that, right? And we do. Anybody ever had a muscle spasm? So the body thinks, oh my gosh, I got some tissue damage here, I got some nerve irritation, I got to try and stabilize this thing. So we have a reflexive muscle spasm. We try and clamp it down, we hold it down. But here's the problem, if that subluxation, that misalignment does not get corrected, guess what happens to the muscle? It becomes dysfunctional, it becomes deconditioned. We start to attract fatty infiltration into the muscle. We start to attract fibrotic adhesions, scar tissue into the muscle. We got to decondition muscle. Okay? So we have a misalignment, we got tissue damage, we got inflammation, we got nerve irritation, and now I got to decondition muscle. Now what happens is that doesn't just happen to the muscles, it happens to the joint too. If we freeze that joint over time, we're going to start laying down scar tissue and fibrotic adhesions in the actual joint. That joint's going to get stuck. Okay? In other words, it's not going to move. It's going to be fixated. So a normal spine moves like this. When we have a chronic subluxation, that puppy's stuck. So you guys ever notice we do like the subluxation dance with you? We're trying to find this. Okay, we're trying to find that stuck vertebra. Now, have you guys ever heard the expression, if we don't move it, we lose it? Okay, so we freeze that joint. Guess what happens to the joint?
Loses the flexibility.
Yep, and it starts to deteriorate. Starts to degenerate, okay? And it starts that degenerative process, okay? So, now we have a misalignment, we got tissue damage, we got inflammation, we got nerve irritation. We had a deconditioned muscle. Now I got a joint that's stuck and it's actually deteriorating and progressing. That sucks, right? And it doesn't stop there. As a result of that lack of movement, you don't just have a deteriorated joint, you don't just have a decrease in range of motion, it actually triggers a stress response in the brain. Okay? So what I'm going to attempt to do is teach you guys 2 years of neuro, spinal, physiology in 2 minutes. Okay? All right. Research by Nobel laureate Roger Sperry teaches us that 90% of stimulation and nutrition to your brain comes from movement. Okay? More specifically, movement of the spine. Okay? I gotta grab a spine. Or else this won't make sense. Okay? Now, the reason that movement acts like fuel and nutrition to the brain is every time we move a joint, we got receptors within all of our joints. Okay? When we move that joint, we activate those receptors. It sends a signal to the brain. The brain likes that. It acts like fuel and nutrition. Any of you exercise? Usually you feel really good after an exercise, right? It's because of that fuel and nutrition from those receptors, and eventually we have a hormone cascade that happens that makes us feel good. Okay? So when we look at all of the joints in the body, when we look at the spine, is there a lot of joints in the spine? Yeah. There's 24 individual movable segments in this spine. Some of them actually have 8 joints on them, or 8 articulations. So this spine, largely embedded with those receptors. Not only that, we got a lot of teeny tiny muscles within this spine and around the spine, right? To hold us upright, to keep our posture. Now those muscles also very densely populated with those receptors. So if we freeze a joint and we decondition a muscle in the spine, we no longer get that fuel and nutrition to the brain. We no longer get that proprioception, is what we call it. And if we have tissue damage, if we have inflammation and nerve irritation, we always have a constant barrage of noxious stimuli to the brain, what we call nociception. It's like static to a phone line. So we got all this cruddy, noxious stimuli going in, and we're not getting the fuel and nutrition that we need and the brain desires. And the end result is a stress response. Anybody ever had like a serious acute stress response? All right, Joe, I'm going to give you an example. You and Sarah, you're on a picnic, okay? You guys finally get a date, away from the kids, right? You got your lunch packed, you go up to Vita-Boo, set out your blanket, pour some wine, and you look over, Joe, and there's a mountain lion 10 feet away from you. Now there's 2 options here. You gotta either fight, or you gotta flee, right? That's our fight or flight response, our stress response. What kind of guy do you think Joe is? Do you think he's gonna fight or is he gonna flee? Anyways, what you're feeling right there. What you're feeling right there, that's the acute stress response. Now in that situation, what happens to Joe's stress hormones? Cortisol. Yep. Stress catecholamines, norepinephrine, epinephrine, adrenaline, noradrenaline, through the roof. In that situation, good thing, great thing, right? What happens to his heart rate?
Goes up.
Goes through the roof, right? What happens to his blood pressure?
Goes up.
What happens to his respiration?
Goes up.
Through the roof. Is Joe going to need some energy to either fight or flee? What do you think happens to his blood glucose? Goes up, right? Just in case this fight lasts a little bit longer than what it should, he's going to need some reserves, right? So what do you think happens to his blood lipids, cholesterol, triglycerides? We need some energy. We're going to start mobilizing it. It's going to go up. Short term, is all of that a good thing?
Mm-hmm.
Absolutely. Short term, it's going to save his life, and hopefully save Sarah's life too. Okay? Long term, what does that look like? Elevated heart rate,
Stress.
elevated blood pressure, elevated blood glucose, elevated triglycerides, cholesterol, right? Elevated stress hormones. You got it. Heart disease, diabetes, metabolic syndrome. Can you guys see that? Okay. Now, on the flip side of everything, he's got a lot of organ systems that he does not need to use in that situation. body's going to start down-regulating some of those. So, what do you think about his long-term and short-term memory? Is he going to need those? Does he need to remember what color Sarah's blouse was? No. Okay? Does he need to remember how to do long division?
No.
No, not a chance, right? What do you think happens to digestion? Shuts down, downregulating, right? What do you think happens to his immune response? Downregulating. Now, if he survives the attack, he can crawl back in the cave, kick up his parasympathetics, and fight the infection. But right now, downregulated. What about reproduction? Downregulated. Right? Do we have some digestive issues in this country? Okay. Do we have some concentration issues, some dementia issues? Do we have fertility issues and immune system issues? Okay. So what I'm saying is every single chronic illness under the sun is exacerbated by this stress response. This stress response contributes to all chronic illness. Everything. And what I'm telling you is a subluxation, abnormal movement, motion, mechanics, and nerve irritation triggers a stress response in the body. Short term, saves your life if you're in that situation. Long term, a stress response is going to shorten your life. So my question is, if you guys had to choose between a back problem and a brain problem, which one would you want? Trick question, right? I pretty much just told you a back problem is a brain problem. Okay? And it is. That's why we get so passionate about what we do in here, is because we know when we lay our hands on somebody and adjust them, we're not just helping their back, we're helping their health. We're helping their nervous system. Okay? That back problem is a brain issue. We're trying to balance that out. So there's many people out there that don't know that we can help with conditions like this: headaches, pain syndromes, okay? Maybe blood pressure, asthma, allergies. By no means am I saying that we have the cure-all for all of these. That is not what I'm saying. But what I am saying is when we look at all these conditions, we cannot overlook the role the spine plays in it. Make sense? Now guess what? Jonathan, you can have a subluxation without any signs, symptoms, or anything's going on. Just like with heart disease, just like with cancer. Only 10% of the nervous system is responsible for picking up and perceiving pain. The only way you're going to know if you have a spinal issue is to get evaluated by a chiropractor. The only way I know if I need to get adjusted is if I have my wife check me, right? See, I love chiropractic so much, I married my chiropractor. That's strategic living right there, right? And here's where that very first subluxation can occur. In this birth process and delivery itself. How many parents in the room? Not yet? Okay. All right, this is our average 7.5-pound baby, okay? I just want you to get an appreciation for her weight, okay? And then you pass her on to Kim there and pass her on down the road. Now, when we have a brand new baby, guys, we're always going to support their what?
Head.
Their head and neck. You got it. Why would you do that?
They don't have the strength.
Yeah, they got an underdeveloped musculoskeletal system. You let that thing go, it's just going to flop, right? And all of us have seen that happen where we're like, yeah, we freak out. We realize that could be problematic. So, if I took Sarah's baby and I just did this,
Oh my gosh.
yeah, you guys felt that 7.5 pounds of pressure of pull right there. Think that could do some damage to that baby's spine? Okay. Some of our modern birth practices, we're putting upwards of 35 pounds of pressure of pull on this baby's underdeveloped musculoskeletal system. That's why we check kids, okay? And that's why if you've even been through this process, you probably need to be checked also, okay? All right, so everybody understands why we check kids? Okay, good. You guys came for better results, so here's our equation, right? Number one, every single one of you had a specific evaluation. Based on that evaluation, based on your complaints, based on your findings and what we found, we gave you a course of care, a program of care, right? To try and get some stabilization. First things first, we got to maintain that corrective rhythm. Okay? We can't miss or skip appointments. Each visit builds on the one before it. Okay? We got to get things moving in the right direction. 2, you got to figure out what you're doing outside of the clinic that's causing your recurring subluxation pattern. Are you sitting for 8 hours a day? Do you have a mattress that's 10 years old? What about your lifting mechanics, right? What are you doing that's actually contributing to this pattern? And then 3, you got to add in the corrective exercises that we give you. So through your care, we give you corrective exercises. All we ask, just do them, okay? And if we follow this equation, we tend to get pretty predictable results. So you guys, if you're a patient, you've all had one of these scans, so you kind of know how to interpret it, right? So if you're a guest, what we're looking for here is we're looking for inflammation. We're assessing heat, right? And when we look at a scan like this, if we see anything other than yellow, that's telling us we're picking up high heat, high inflammation, can cause nerve irritation. So when we look at Lori's case here, one of my favorite patients, are you guys surprised that she came in with neck pain? Okay? Her neck pain was so bad, 10 out of 10, she was willing to do anything to get rid of it, right? Even chiropractic. And she was a chiropractic skeptic, okay? And after a course of care, after a few months, obviously this pattern balanced out and she's no longer dealing with her neck pain. However, here's the cool thing about Lori's story. Have any of you ever heard of Meniere's disease? Okay. So usually it comes with vertigo, tinnitus, ringing in the ears, right? A dizzy sensation. Lori also suffered from Meniere's disease, and she has for quite a while. Okay? And her vertigo, her dizziness had gotten so bad where they did a seriously invasive procedure to her inner ear. Essentially, they just killed the inner ear to try and solve the problem. But she's still dealing with vertigo. She still has the tinnitus. So bad, some days she doesn't feel like driving because she just is not confident. Some days she's literally walking into walls. She wants to start working out. She'd like to get on a treadmill. She has one home, but that scares the bejesus out of her, right? She can't even walk down the hallway without bumping into the wall. After a course of care, not only did her neck pain go away, her vertigo went away as well. The result of that correction, or excuse me, the cause of her symptom, her vertigo, was that subluxation pattern. We had to get a correction. Okay? And Brent came to us as an 8-year-old boy, and in his particular situation, what was going on is he had a widespread rash. He had global joint pain. No rhyme, no reason, no pattern, just rash and joint pain. Couldn't find any trigger or anything. Got so bad, this kid literally couldn't go to school some days, couldn't play sports, couldn't have sleepovers. His mom was missing a lot of work. So of course they take him to their doctor, the medical provider, and he says, I have no clue what's going on, but what you need to do is you need to take him down to Children's Hospital in Denver and talk to a specialist. So they do that, run a bunch of lab work, and what they find out is Brent has a non-specified autoimmune disorder. Pretty much just says, we have no clue what's going on, but something is going on with your immune system. Okay? And in the medical profession, there's a time and there's a place for drugs and surgery. But in Brent's case, what do you think he got? Drugs, right? So he got a drug, which led to another drug, which led to another drug, which led to another drug, and then another drug. Got an 8-year-old boy, 5 different medications. Still has a rash, still has the joint pain. So now his mom has literally lost all hope, crying herself to sleep every night, does not know what to do. Now, when you're in that situation, you'll try anything. And they got referred to us by a family friend, drove all the way from Bennett, Colorado, so they had to travel 2 hours to get here. And in Brent's case, what we found is he had a massive amount of inflammation in the upper cervical spine. Okay? He had a C1 subluxation. And because of that nerve irritation, it manifested as a non-specified autoimmune disorder. Right? His nervous system wasn't functioning appropriately, and it created an abnormal response in his immune system. After a course of care, few dietary recommendations, 2 months, this kid's not on any medications. He doesn't have joint pain, he doesn't have a rash, and he's a pain in the butt. Ornery, normal, 8-year-old little boy. He's 10 now, and they moved to Oklahoma, so we don't get to care for him anymore, but he's still under regular care, and he's doing phenomenal. Still not on any drugs, still doesn't have any of the symptoms. What if Brent's parents wouldn't have tried something different? 10 years, where would Brent be?
Miserable.
Who knows, right? And what really keeps me up at night is, gosh, gosh darn it, what if we would have just checked this kid's spine since the day he was born? What if we just maintained it, right, all the way through his life? Could we have prevented a crisis? Yeah, I really think so. Okay? Which brings me to my last point here. Cody, yeah, I know you forgot, so I put it in here.
I was going to ask, don't worry.
The third reason we're in this health crisis, this healthcare crisis, is because of procrastination, right? We put off our problems for way too long and we just think they'll go away. Procrastination is literally the biggest thief to health. The 5 most dangerous words in healthcare today are maybe it will go away. I hear it every day. Bob, you've been struggling with lower back pain for 15 years? Why today? Oh, Doc, I thought maybe it would go away. Okay? Can you imagine if we treated our finances like that, just rack up a bunch of debt and then just ignore it? Maybe it'll go away. Does it get worse or does it get worse? We can't ignore our way out of a health crisis. We've got to stop procrastinating. Right? I know through this entire discussion you guys were thinking of somebody that needed to hear this message. Who was it? Okay, send them in. See if we can help them. If you know somebody that's struggling and they've been procrastinating, or maybe they've tried everything and they just haven't found any solutions, let's see if we can help them. If you're a guest and you want to see if we can help you with something, by all means, I'd love to sit down and do a consultation, examination, figure out your health goals, your health challenges, see if we can help. Do a detailed consultation. Take any and all necessary x-rays. Explain those x-rays to you. Show you what's going on. Tell you if we can help. Normally that experience in our clinic is $250. But my way of saying thank you for listening to me talk for an hour is if you're a guest in the room, I actually do that at my expense, if you want me to. But there's a catch. There's always a catch, right? No more procrastination. If you want to take me up on that offer, you got to schedule your appointment before you leave tonight. Okay? Tomorrow, $250. Okay? All right, I want to leave you with one thing to sum this up. One short little video. Me. It'll work. I promise.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
2 different lives there, right? We always like to say there's 2 different lives ahead of anybody. Right? We got the life of probability, which says, hey, if we continue to do what we've been doing, we'll probably end up getting exactly what we've been getting. And for most people, that's this. For 80% of the population, 80% of the population is going to die or suffer from a chronic illness. In some way or another, this is how the majority of people's lives end up. Okay? But then we got to realize there's another path for us, right? The life of possibility that says, no matter how old you are, no matter what you're struggling with, you can still get better. you can still get healthier and stronger over time. And I've seen it over and over again. And that's this side. However, it's only a small percentage of the population. So our job, our goal, if you're a patient in here, man, I'm going to be a pain in your butt. Okay? Because my job is to kick you and push you and pull you in this direction. Okay? And we want to do that for an entire community. But we can't do it alone. So if you ever can think of anywhere you'd like us to speak, whether it's a business, organization, maybe a church group, a mom's group, a book club, I don't care what it is. If you feel like somebody needs to hear this message, by golly, I'll bring a meal and this exact same message, and we'll help only the people that want our help. So if you ever want us to come in and speak somewhere, just let us know. We'll hop all over it. Okay? I want to thank every single one of you for coming tonight. You're letting us fulfill this mission and our purpose, right? Which is to educate, empower, and adjust as many families as possible on their journeys towards health and true wellness. And I look forward to helping every single one of you on your health journey. So if you guys have any questions, by all means I'll stick around for a little bit longer. If any of you wanted to schedule an appointment, Allison can help you up front. It's worth it. Thanks, Joe.